Hello, my name is Lauren McCoy, and I'm going to be assessing Todd here on his head, face, neck, and lymphatics. Todd, before we get started, I just want to make sure and verify that you're okay with being on YouTube.
I'm okay.
Okay, great. The first thing you want to do when assessing a patient is make sure we take all their vital signs, which would be their height, weight, blood pressure, pulse, respiration, oxygen saturations, anything else that would be specific for this type of assessment. We have done that already, and all of his are within normal limits. The next thing that we want to assess is his history. Specific to this type of assessment, we would want to ask him about any kind of chronic headaches, head injuries, dizziness, neck pain, or any kind of lumps or swelling that he's noted. And we have asked him that already, and he is denying any of those at this time. So we want to go right into the assessment, and starting, we would want to just inspect the skull. That would be the size and the shape of it, making sure that it's normocephalic, which means round and symmetric. And his is. The next thing we're going to do is palpate the skull. And Todd, just let me know if there's any kind of tenderness noted when I'm doing this, and I'm going to be feeling for any kind of lumps noted by putting my fingertips through his hair. So just making sure that everything is symmetric and even and no tenderness noted. Did you note any tenderness with that?
No, ma'am.
Okay, so the next thing we're going to do is assess the temporal artery, which is going to be located superficial to the temporalis muscle and anterior to the ear. When doing this, we're feeling for the pulsation of the blood running through the artery, making sure that they're strong and even. So I'm going to go ahead and do that, and it's just a light touch. Okay, and his are strong and even. The next thing we're going to assess for is the temporomandibular, which is going to be right at the angle of that jaw joint. And when doing this, I'm going to ask him to open his mouth, and we're just going to assess for any kind of limitations or tenderness that he has when doing that. So Todd, if you'll go ahead and open your mouth for me. Okay, and close. Did you note any kind of pain or tenderness with that? Okay, great. The next thing we're going to assess is the face. When looking at the face, we're looking for facial symmetry, when they have facial expressions, making sure that they're even and symmetric. And this may vary based off their ethnicity or their ancestry, but ultimately they'll be symmetric. We also want to note any kind of swelling or any kind of involuntary movements like tics. And Todd is none of those at this time. So we're going to roll right into the neck. When assessing the neck, if you'll just lift your head up for me, we're just making sure that it's midline and that it's symmetric as well. We're also going to assess his range of motion. So Todd, when I'm doing this, just let me know if there's any kind of pain or tenderness, but we're just going to assess basically the muscles within your neck. So if you'll just go ahead and put your chin to your chest for me. Okay, and then go ahead and turn to the right, turn to the left. All right, and the next thing I'm going to have you do is just put your ear to your shoulder, but without shrugging your shoulder up on the right side first. And then to the left, and then extending your head backwards. Okay. Did you have any pain or tenderness noted with that? Okay, we're going to roll right into muscle strength, and that's going to be assessing the cranial nerve number 6. When doing this, I'm just going to put some pressure to add to that resistance to see if you can withstand the resistance. I'm going to start with putting my fingers on your shoulders. If you'll go ahead and shrug your shoulders for me. Okay, and then if you'll turn your head to the left and to the right. All right, any pain or tenderness noted with that? And he had very good strength with that as well, so that nerve is working well. The next thing we're going to roll into is the carotid arteries. When assessing the carotid arteries, you only want to assess one at a time because it could cut off the blood flow to the head if doing both at the same time. What we're assessing for is basically a brisk localized pulsation running through the carotid artery, and that's going to be located directly under the jaw right here. So we're just going to feel for those, make sure that they're strong on both sides. And his are great. So we're going to roll into the lymph nodes next. There's actually 10 groups of lymph nodes just within the head, face, and neck alone, and those are the ones we're going to be assessing. When assessing the lymph nodes, I myself am going to be looking for the size, any enlargement, any kind of swelling noted or tenderness, and you want to make sure you're using a circular motion and using your fingertip pads, and that's actually best because it detects the most sensation. And also making sure that we use a gentle touch, not a hard pressure when trying to feel for those lymph nodes. The first one is going to be the pre-auricular, which is just going to be in front of the ears. And then you have the posterior auricular, which is going to be directly behind the ears. Then the occipital, which is at the base of the skull. And then the submental, which is going to be at the end of the jaw here. And then the submandibular, which is going to be kind of in between the jaw and the angle. The jugulo-digastric is going to be at the tip of the angle here. And then you have the superficial cervical, which is going to be right here, kind of in the middle of the neck on this muscle here. Then you have the deep cervicals. Those ones are a little bit harder to assess, so we're going to skip over those. They kind of run directly here. There's a couple of them. And we're going to go right into the posterior cervical, which is kind of in the triangle here in between the muscles of the trapezius. And the last one is going to be that supraclavicular, and to assess that one, it's actually kind of behind the clavicle. So Todd, if you'll kind of hunch your shoulders a little forward for me, and it's going to be more like directly behind the clavicle here. So did you have any pain or tenderness noted with any of those lymph nodes? Great, and I didn't feel any kind of swelling or enlargement in those lymph nodes either. So the next thing we're going to assess is the trachea. When assessing the trachea, we're looking at it, just making sure that it's midline and symmetric as well. And we want to assess for the tracheal shift. So I'm going to use one finger to put at the sternal notch down here and the other one to put on the other side. And we're just making sure that it's even on both sides with those fingers. And it is. And then we're going to roll right into the thyroid gland. With the thyroid gland, you actually have them tilt their head up just a little, and we're just looking and assessing the thyroid, making sure that it's not enlarged at all, and that runs directly, parallel with the trachea. So we want to make sure it's not enlarged, and we're actually going to have him just do a hard swallow, and when he swallows, we're assessing that that thyroid gland is going to go up when he swallows and return back to a resting position when he's done. So you just take a hard swallow for me, Todd. Okay, so it does rise a little bit when he swallows and returns back to normal when it's done. What we're also going to do is do a posterior and anterior approach for palpation. We want to palpate that thyroid gland. The posterior approach is the easiest, so we'll start with that one. And with that one, you want to go behind the patient, and you're going to have them tilt their head slightly forward and to the right. You'll go ahead and do that for me, Todd. And you're going to take basically your fingertips, and with one hand, you're going to be pushing the trachea over, and with the other one, you're going to be actually palpating the thyroid gland. You want it to be smooth but rubbery. And Todd, if you'll go ahead and take a good swallow for me. And again, when he swallows, that's when it's going to run through those fingertips of yours, and you're going to be able to feel the thyroid gland. I didn't feel any enlargement. The other one is going to be the anterior approach. This one's a little bit more difficult, but we'll go ahead and show that one as well. So again, you'll have the patient turn their head a little slightly forward and to the right. You're going to stand in front of them this time, and you're going to use your thumbs instead of your fingertips. So you're going to deviate the trachea with one of the thumbs, and with the other one, you're going to be palpating the thyroid gland. So Todd, if you'll go ahead and swallow for me. Again, just making sure that that thyroid gland is not enlarged. Did you have any pain or tenderness noted with that? Great. If you do have enlargement of the thyroid gland, you would want to auscultate for a bruit, but since at this time he doesn't have any enlargement, we don't need to do that. And that's going to actually conclude our assessment.